Okay, so I'm going to go ahead and get started. Hi, everyone, and thanks for attending our session today on gray literature, what it is, and how to find it. My name is Lily, and I'm a librarian at the Levy Library. I'm joined today by my colleague Samantha as well, who will be speaking in the second half of today's session. Next. So today we'll be talking about gray literature, going over what it is, where you might go look for it, and why you might consider incorporating it into your research. We'll also go over thinking about planning and conducting your gray literature search, including a quick search demo that Sam will do later on. We'll also talk about how you can evaluate gray literature and the potential issues that may come up when you're using it. At the very end of today's session, we're going to try to leave some room for questions, but feel free to ask any questions in the chat as well. But I wanted to start with a poll today. Do you regularly search for gray literature sources when conducting a literature review? Okay, so I'm going to end the poll. And so it looks like we have pretty even answers across the board, yes, no, and unsure. And it's this isn't super surprising to me. Gray literature can be a little murky to navigate, but I hope that by the end of the session, you'll all feel a little bit more confident about incorporating it into your research, or at the very least have some tools and resources that can help guide you. So next slide, please. So I wanted to start out with kind of going over what is gray literature. And this is the official definition of gray literature that was kind of presented by the 12th International Conference on Gray Literature in Prague in 2010. I'm not going to read all of it. It's a bit kind of opaque, I find. But basically what it conveys is that gray literature is the documents where publishing is not the primary activity of the producing body. So this can be across like a bunch of different sectors like government, academia, business, other industries. And I don't really like to think of this definition when I'm thinking about gray literature. So I wanted to present a kind of simplified way that I like to think about it. And that is that gray literature is everything but peer-reviewed journal articles and academically or commercially published books. And as you can imagine, this encompasses like a ton of literature from a lot of varied sources. Next slide, please. So the sources that gray literature can come from can include government agencies like the CDC and NIH, who might produce things like fact sheets and reports. It might come from universities that might have, institutional repositories where students and researchers publish their work. Think tanks, nonprofits, and professional associations might also produce material that's not formally published in traditional publishing channels like peer-reviewed journals and in books. Next slide, please. So these are just some of the types of gray literature out there. It's definitely not an exhaustive list at all. In the handout that I sent through the chat earlier, you'll find some resources where you can search for many of these types of gray literature. So next slide, please. So you might be thinking that locating gray lit is potentially difficult or, like unclear where you need to start. So why even bother putting yourself through this process? And what is important to remember is that Greylit can give you a much more comprehensive overview of scholarly conversations surrounding your topic or your specific fields. It's also often much more current than traditionally published literature. As I'm sure many of you have experienced, the publishing process can take a super long time. This is why Greylit is especially helpful for emerging topics and fields that may not have a huge published literature base. It's also a good source of data you otherwise wouldn't have access to, as well as information on policies or procedures that might be outlined in things like organizational reports or policy briefings, which don't get published in peer-reviewed journals. In addition, using it in your research may also help reduce publication bias because negative or insignificant results often go unpublished. And this is an especially important point to think about when you're conducting a systematic review. In fact, a lot of journals actually require that you go over your Greylit search methodology in the methods section in order to publish a systematic review with them. So it kind of depends where you're publishing, but some journals are more kind of strict about it than others. So next slide, please. So zooming in a bit more on systematic reviews, this is a screenshot from the Cochrane Handbook of Systematic Reviews, which is kind of the Bible, quote unquote, for systematic review best practices. And they say that searching for gray literature when conducting a systematic review is highly desirable. And the purpose of this, again, is to reduce the risk of publication bias and identify as much relevant evidence as possible. And next slide, please. And so in practice, this can be a little murkier. This quote is looking at specifically the effect of including unpublished clinical trials to assess an intervention. And I just wanted to show this to highlight the fact that there is some conflicting evidence out there on the effect of including unpublished trials in systematic reviews. The extent of the impact is still kind of unclear. So when you're deciding on whether or not to include data from unpublished trials, you should consider the time and effort you're willing to spend on searching with balanced with the effort to reduce publication bias as much as possible. So next slide, please. And I also wanted to mention that your research question may also be important to take into account when you're considering whether or not you want to do a Greylit search, as well as what type of Greylit you might want to search. So this is an example of a method section from a Cochrane review that looks at a specific intervention for preventing and treating influenza. And I just wanted to have throw this up here for a second, just to show that there is a combination of electronic searches that you might traditionally do in, the major databases, Medline, Embase, et cetera, as well as a description of a search in other sources. So for example, as you can see in the bottom, they do search the FDA and some pharmaceutical companies for trials that they might have that are that they might have data on that are unpublished. So because often the FDA and separate pharmaceutical companies do have this, and it might kind of like affect the outcome of your finalized systematic review. Systematic review once you finish it, sorry.
Systematic review conclusion.
My brain today. Anyways, so now that we have a kind of general overview of what Greylit is and how it can be used, I'm gonna turn it over to Samantha, who will go more into the nitty-gritty of planning and conducting Greylit searches.
Thank you. Yeah, so I feel like Lily has done a really great job making it clear that gray lit is almost kind of this catch-all term, or at least to me, it feels like this catch-all term for everything but the standard stuff that we search for, everything but the materials that are typically indexed in a a database like PubMed, or that like a library might index in their catalog, and so it's important to remember that that's really all that brings these materials together. We're talking about, clinical trial, like, registered clinical trial data, as well as, maybe like a report from a local government, stuff like that. So there's really very little, that ties these types of materials together, besides the fact that that there's really no easy way to kind of comprehensively search for them. However, some materials have easier, are more accessible than others. However, when you are conducting a review, or just a search for information, whether it's systematic review, literature review, or again just a search for information, you don't want to say to yourself, okay, I'm going to do a gray literature search. You want to tell yourself, okay, I'm going to search for this type of information. You want to tell yourself, like, okay, I'm interested in preprints on this emerging disease because peer review takes a long time, and I want to see kind of like what studies are out there that maybe haven't made it through that process yet. Or you might say to yourself, okay, I need to make sure that I look for data from nyc.gov from the school districts, because I need information on school meals for my research. So it's not you want to kind of, the first thing you want to do is not say that you just want to find everything and start Googling, but you want to actually kind of step back and think like, okay, what is it that I'm looking for? Who might be producing this information? And then once you have that kind of in your head, then you can kind of start even limiting yourself further and think like, okay, do I care about school meals from 20 years ago? Is that relevant to my research? Do I care about school meals outside of New York City? Is that relevant to my research? Is that relevant to my population? And so that is kind of the best way to set yourself up for success in kind of planning your gray lit search, because there is absolutely no, people have tried, but there really is no kind of centralized location where you can search for gray literature. There is no PubMed for gray literature. And so, you could go to Google, but you're going to have a really hard time. So that is why thinking about exactly what you'd like to find is the best place to start. So you might realize that you want, again, kind of like population data and statistics. And again, it comes down to who is producing that information. So typically the CDC and the WHO are places that in the healthcare realm, we might go for information like that. Conference abstracts and proceedings, those are kind of an easier form of gray lit, in that we do have databases that we pay for. I would probably say Embase is the most complete database in terms of including conference abstracts and proceedings. However, there's a specific conference you're interested in, you definitely want to make sure like, where is that conference indexed in Embase? It might not be, but then you have the option to just go to that conference's website and search there. I will say that so much of gray lit searching is just going to the producing body's website very, very often. Preprints, which I mentioned earlier, are another really, I would say, kind of right now, super emerging, important type of gray literature, where authors of scholarly journal articles submit their manuscripts to preprint servers as they're moving through the publication process, so that their data and their findings and their manuscript are available in this preprint version before they're published by the journal. And, there's a lot we could talk about around that, from the authorship side and from the readership side. But for now, I'll just say the best place to go for right now is medRxiv, which is that middle source I have there, if we're thinking healthcare preprints. Clinical trials, that's definitely the type of gray lit that you'll think about first when you're thinking about a systematic review. And I would say clinicaltrials.gov and Cochrane's RCT database, which is Cochrane Central, do a great job of bringing all of that together for us. Dissertations and theses. So there are a few different databases of just dissertations and theses, such as ProQuest, but you will find many / most dissertations and theses that are available online in Google Scholar. Finally, guidelines. So guidelines come from different kind of healthcare organizations, health systems, et cetera. And it is really important to kind of try in a lot of our literature reviews to try to see if there is a consensus among guidelines, look for maybe the most updated guidelines in a certain area. And so having a place where we can find as many guidelines as possible can be really useful. So I recommend the TRIP database, which is the last example listed here, although these are all great. Like I will say that you will find guidelines indexed in PubMed and Scopus and Web of Science because they were also published as journal articles, but that's not all of the medical guidelines that are out there. Those are just the ones that were published in that manner. Finally, reports, white papers, et cetera. So that's always a situation where you're like, okay, I know that this organization, whether it's a think tank, government body, et cetera, I know that this organization is doing research or work in this area. Let me just go directly to their website and see if they've published anything that might be of interest to me. And finally, regulatory information. So if you do enough digging, there is always a ton of regulatory information on drugs, devices, vaccines available to us from the FDA or from, other countries such as, the European Union and Canada, their equivalents of the FDA. So all of that information will typically describe an approval process, as well as actually cite and describe the same clinical trials that you might be looking at for your own research. So sometimes that's a really interesting way to kind of gain another understanding if you are doing research into a certain drug. So we are going to actually take a look at what it looks like to search the FDA's website for drug information. And so there's a ton on here. What I want to show us is the FDA drug approval package, which for any drug that was approved, so any drug that the application was submitted post, during or after 1997, we're able to find on the FDA's website. And so why I think that this is potentially very useful is that I think it mirrors, it kind of mirrors finding gray literature in maybe its like most annoying form. Like I said, we have some great clinical trials registries that we can search. We have preprint servers, but this is definitely a situation where maybe like a report, like a white paper, stuff like that, we have to go straight to the source. We have to kind of dig around. Sometimes there's a weird search functionality. And so it does take a little bit of time. And of course, I think, the FDA approving things is maybe something that's on our mind right now. So if we start at the FDA's main page, we'll scroll down and we'll say products we regulate. We are interested in a drug. We'll scroll down a bit more. And what we're looking for is drugs at FDA, so drug approvals and databases. So you can just go to, you can just Google drugs at FDA and get yourself here. But what I want to do is actually get myself again to drugs at FDA search. And so I'm going to search Tamiflu. And we get a list of products. This is just for demonstration purposes. If I was doing this for a review, I would not only search the trade name, I would also search, the generic name, maybe the name that was used while it was in clinical trials production, all of that to make sure I had a really complete search. But for the purposes of this, I just searched Tamiflu. I do see that they have a record, and I'll take a look at this first one. And so there is a bunch of information here, but again, what I said I was looking for, which I do think is the most useful, unless we're looking for just really basic information to report on, like, this is kind of the FDA's recommended usage and the FDA's, updated label for this drug. All of that is available here. But what I want to look for is the initial approval package. So what did the FDA have at their disposal when they were approving this new drug? And so what I want to do is find, again, the original approval, and I want to look at the review. And that brings me to this really useful page that has a bunch of information on it. So if you're interested in kind of the statistical work that was done, that kind of breaks down the understanding of the clinical trials that were completed before this approval, I would take a look at the medical reviews as well as the statistical review. However, you might be interested in kind of any other of these components. So I definitely recommend playing around with this if this is something that's of interest to you, as well as accessing that Cochrane systematic review that describes kind of how they did this process that we put up on the slides earlier. I think that does a really great job kind of explaining how, because it was a systematic review, they had to come up with a very systematic way to do this searching, which on a page where you kind of have to hunt and peck was very useful to them. So back to our slides. So evaluating gray literature. So a bunch of things about gray literature to think about is currency. So I think very, very often we end up using a gray lit source because one of our sources used it. So we're doing a review on, let's say, Tamiflu, and one of our sources cites a report by the CDC about a certain number of infections during a given year. Don't just use that report. See if that same body, that same organization has a newer one. Another thing to think about is the publisher or creating organization. It definitely is a good idea to get a good idea for kind of like what organizations are reporting on this topic by using your sources. And that is why you do want to be careful with Google and just going into Google and starting to kind of like look for different, different reports on, drugs and stuff like that. Funding. So this kind of goes right into, so funding and authors definitely goes right into thinking about the creating organization. If you are looking at, even when you are looking at a study, you want to think like, why was this conducted? Why was this published? Why was this written? Who provided the funding for this? If you can't figure out who provided the funding for the specific document or report you're looking at, check where the funding comes from for the organization. Look into the authors, see where they're employed, see if they have any kind of conflicting funding situations. These are all things to think about. And I would say if you are ever kind of citing a gray lit piece of information from anything really besides a government body that a very reputable kind of like large health organization, or or a pharmaceutical company, unfortunately, you want to kind of be asking yourself all of these questions. For things like reports and white papers, you want to see, are there references? Are they kind of incorporating the larger conversation? And how does this information fit into the larger conversation? Is this like way out of left field, or am I kind of looking at something that fits in? And finally, with kind of all of the above, is there transparency? Can I easily tell where the funding came from? Can I easily tell who these authors are, et cetera, et cetera? So there are some issues with gray literature. As useful as it is to search, and as much as I think it can really set us apart for kind of for when we're publishing and we're incorporating this information into our work, there's really no gold standard for searching. As these are totally different pieces of information we're looking for, there's no, like I said, general repository. People have tried. There are attempts at general repositories, but there's none that I would say are, incredibly useful. And again, there's no clear publishing guidelines. So, an organization might put out the same yearly report in, 2014, 2015, 2016, and then just like skip 3 years. And you as the, kind of as the searcher might end up just super confused on their website. So it could end up being a little confusing. You'll run into broken links very often when you're on organizations' websites. And it's definitely a little bit more confusing in terms of copyright when you kind of break out of the kind of the academia bubble. Finally, there is kind of just an ever-growing amount of resources and producers. The second you find one resource, you'll find, kind of like another organization publishing the same thing or something similar. Finally, gray literature is not indexed. I will say that certain types of gray literature, like preprints and like conference abstracts and proceedings, are beginning to be indexed, and that's great. We can often, because of that, find those things a little bit alongside our typical sources. And as I've said a few times, no central repositories or databases. And kind of as I said before, we typically let gray literature come to us, which I understand sometimes is the only way. Like, okay, we heard about this organization from our PI. We found this clinical trial that was never published in a reference to one of the sources we're using, and that's great. But imagine if we let the articles that we're citing, if we just only cited things that, our PI emailed to us, that would not really be an unbiased way to report on what's out there. So if you are going to start kind of bringing in gray literature sources that came to you, I would definitely recommend conducting a larger search as well. And we can absolutely help you do that. So if you have any curiosity about any of this, or if you have a specific project that you think could really benefit from a gray lit search, you are very, very welcome to meet with us. We are always available to meet with the Mount Sinai community one-on-one via Zoom to help with projects like that. And please stay tuned for our spring 2021 Zoom sessions, where we will have sessions such as conducting a literature review, intensive searching with Ovid, critical appraisal, and a lot more.